Our decompression table. When it comes to decompression patients, anytime we get any kind of radicular symptoms, so pain that travels outside of the spine, say into the shoulder, the arm, or like sciatica type stuff, or any pain that shoots into the leg, they're almost always going to automatically be a candidate for decompression. What it does, when we've got a normal, healthy spinal disc, it's nice and hydrated. The way that it gets its nutrition is through a process that's called imbibition, which just means it kind of sort of acts like a sponge, where if a sponge is sitting in water and it doesn't get kind of moved around, nothing goes in and out. It just sits there. So the nutrition is just sitting kind of around this, and through movement is how we keep a healthy disc. It's part of how chiropractic works, because we unlock those joints and get them moving to create some health in that disc as well. Oh, wow. Okay? So when that disc starts to break down, so basically it's not moving properly for whatever reason, it'll start to dehydrate, and that weakens the rings that are around the nucleus in the middle to the point where we can even get it kind of to bubble up and kind of start to stick out, and those are slip disc, herniated disc, bulging disc. People kind of use those terms a lot of times interchangeably, but it just means that disc is bulging out somewhere and it potentially is compromising that nerve. Now, and when we get to the point where something is compressing on that nerve, one, we want to get motion back in there, so that's where the chiropractic rehab and the medical stuff that we do to get the muscles to loosen up comes in. But decompression can even take that to the next level, because they're going to lay on their back. And in the low back, when we anchor and pull, it's not going to like pull and separate these, but it's going to create a negative effect, so that nutrition has an easier time getting back in there, especially if it's already dehydrated and damaged. Because to get to a point where it's dehydrated and damaged takes years. This is not something like, if you hurt your back tomorrow, that probably had been coming for a long time. That's like saying a cavity happened when I bit on a Snickers bar yesterday. Nope, it was coming, right? And so anytime that we can do that, decompression will be a very, very valuable part of the therapy that we do, because it can really, really help increase the health and nutrition of that disc on top of the other stuff that we're already doing. Not every place does decompression, and not every decompression table can also do neck and low back, and we have the ability to do both. So again, it's a really, really valuable part of the therapy that we do, but especially if you have radiating symptoms, because we want to avoid drugs, surgery, even epidurals and things like that. They all have their place, but we want to try and let your body kind of fix itself first. And a lot of times in our healthcare field, we kind of see where they throw drugs and surgery first. You know, maybe you get some rehab, but again, in my opinion, we're not exhausting the conservative care that especially we do in this office, combining chiropractic, physical therapy, and medical all together. Nobody else is doing that but how we're doing it. And most people, when you really ask them, don't want to get cut on. They don't want to take medication. You know, if they're in a bunch of pain, sure, give me a pill for right now, but they don't want to be taken a week, a month, a year from now, right? And so that's where we can be very, very valuable with the stuff that we're doing. Anytime, so if you wake up in the morning, or if you get woken up in the middle of the night, a lot of times what we'll see is numbness and tingling in the hands, or like carpal tunnel type symptoms. A lot of times with carpal tunnel, we'll find the neck is actually the root cause, and the carpal tunnel is one of the later stages of that issue showing up, which is why most of our patients that have carpal tunnel in one hand also have it in the other hand. It might not be as much, but they almost always have it in both. Or if you know anyone who's had carpal tunnel surgery, they almost always, within a handful of years, somebody's trying to get them to do it on the other side.
It could be coming from the neck, you're saying?
Almost always.
Wow.
So now I'm biased. I'm a chiropractor, so I'm concentrating a lot on the spine, but this is the area they share. Wow. And you almost, in order to get an issue here, without kind of major trauma into the arm, it almost always has to be coming out of here. Now, those are patients where I wish they would start with chiropractic, rehab, and decompression as one of their therapies way before we start cutting on them, okay? A lot of the statistics with carpal tunnel surgery, you know, a decade after they have it done aren't awesome, because I don't think they're actually addressing and fixing the root cause, even though they're feeling better for a short period of time.
Wow.
But once you get cut, I can't uncut you. If the stuff that we do doesn't seem to help, you can always go have the surgery. So I would say exhaust everything else first.
Oh, that makes sense.
When it comes to the low back, a similar type of thing. People who, if they stand for like a handful of minutes and they start having that pain kind of shooting into their butt, if they're noticing that they're getting any kind of weakness where one leg will kind of start to give out, or we'll see foot drop once in a while, that's actually the nerve that's telling that muscle to move isn't getting the signal because it's potentially compromised up here. Okay? It's not all the time, but it's the vast majority of the time. It's starting in that spine, but we got to work on all of it. And that's another thing that we feel like sets our offices apart is other than just looking at the area where maybe they have pain, we're going to kind of look a little big picture and see, hey, can we fix a lot of the underlying issues, not just the area that hurts. Okay? And you don't want to wait until it's become a major problem. Like ideally, we want to get a disc healthy before it's ruptured and compressing on that nerve. Okay? But if we've gotten to that point, there are a lot of things that we can do, especially if you're trying to stay away from drugs and surgery. Right, that's the idea. You've got a doctor for your eyeballs, you got a doctor for your teeth, you got a doctor for your skin, you got a doctor for everything, but for whatever reason, we don't prioritize getting a doctor for your spine, because if it wears out, I can't give you a new one. Your teeth wear out, like we have some options at least. Your spine wears out, we're in trouble. There's some gurus that I listen to, and they'll say things like, live your life like you're trying to make the last 10 years of it as healthy as possible, right? Like health is not different than like finances. If you start putting away money when you're young, it kind of compounds and now you can enjoy it when you're older. If you don't take care of yourself when you're feeling good and healthy, it's so much harder to backfill it and get healthy once you're starting to have issues. There's been some studies where they did when they go to, especially I think in like some older communities, and they go to the park and people like walking around the park, half of them already had their first heart attack.
Wow.
Right? Like they waited too long.
Yeah.
And when you have a heart attack, statistically, it's something around 50-50. And the day before they had the heart attack, most of those people probably said they were healthy.
Wow.
That didn't happen in a day. Right? So same thing when people come in, they'll come in with neck issues, back issues, and they'll tell us, oh, I slept wrong. Almost never the case.
Wow,
They had something that led up to it, or they did something before they went to bed, like during that day, then your body went to go and fix it at night, and then they wake up in all this pain going, oh, I slept wrong. Takes a little bit of the blame off the person, not that they necessarily did it intentionally, but chances are something else led to that. It wasn't sleeping. Your body's designed to sleep.
Yeah, come on now.
Right? That's when it's supposed to be fixing and getting healthier, not when it should be like, oh, I know what I should do. Let's lock up this dude's neck in the middle of the night.
Right.
Not what it's thinking. It's thinking, hey, I've been trying to get through. I'm super stressed. Everything's going crazy. Now that he's finally turned off and rested, now I'm going to fix this, which means I'm going to put some swelling in there. I'm going to kind of light up that area. And then all of a sudden he's waking up going, what happened?
Body's saying, don't move me.
Mm-hmm. Our bodies above everything else know that we are dumb and we like to hurt ourselves. So our body always overprotects us.
Wow, that totally makes sense.
Yep. So if you sprain an ankle, you usually can kind of keep going in the moment, and then once you stop, it blows up. Now you can't walk. Okay? It's similar things going on in through here where your body will keep you going in the moment because that's evolution. Your body, if you're injured, it thinks you're being attacked, it's going to let you escape. But once you escape and kind of the stress goes down, now it's going to come in and try and fix you. So in modern times, what that means is there's lots of people who are like every time they go on vacation, they get sick. That's because they're running like this all the time, and then once they finally relax, it kind of hits them.
Bang.
A lot of times people will notice an improvement on the first treatment. Okay, not every time, but in general, because gravity has been beating up that joint all day, every day, kind of forever, how often is it that you get to feel a stretch and an open and like the reverse of gravity? Not very often. And so sometimes just by starting it, they're like, oh, I love this table. Right? I'm sure you've seen it taking people off there, like even the first couple of times, they're like, oh, that was great. And so a lot of times, if you know anyone who's like, hey, I love my inversion table. When I go on my inversion table, it really helps. I feel good. This is an inversion table on steroids. Okay, with an inversion table, you can only do it for a few minutes because blood's flowing down to your head, right? So you can only do it for a few minutes at a time. It's also not targeted really at all. So it's kind of the whole spine being stretched, which isn't necessarily a bad thing. But when we put you on a table, because the machine is doing the pulling and you're laying flat, I can now target specific discs based on the angle, and we're going to do it for 10 to 15 minutes with sustained pressure, more aggressive than an inversion table would do. So it's massively more effective. But if you already get some relief on an inversion table, this table will be your best friend.